Let's look at images here. This is a patient with a hepatoma, a large hepatoma in the left and right hepatic lobes. And looking between February and the following September, we can see that there has really been no significant change in this tumor. It's really quite large. That's not the reply or the result they want to hear. So we need to have other ways to evaluate this tumor beyond that. We can use diffusion on the left, arterial enhancement in the middle, or portovenous enhancement on the right. This is February before treatment. The patient then came back in September, and you can see that the tumor shows diminished enhancement. So decreasing enhancement with gadolinium represents response. That's lesson number 1. There's another parameter we can use, however, and that's diffusion. So this is a patient we can see has a large mass. It's enhancing with gadolinium on the left, and it's bright with diffusion weighted imaging on the right. The patient then came back after treatment, and you can see that there's less enhancement, but in addition, there's less signal on the diffusion weighted images. And on these magnitude diffusion images, that indicates that we have an increasing ADC value. That's another marker of response to treatment. Let's take a look at another case here. This is a patient with hepatoma who's been treated with TACE and ablation. So this is pre-treatment on the left with gadolinium. We can see that after 4 months in the middle here, that lesion no longer enhances, and that at 8 months, we may see a little bit of marginal enhancement. And these are the types of subtle changes we're going to be looking at. In that same patient, we can see that we have additional marginal enhancement that is seen along the inferior of this tumor, both at 4 months and 8 months. So arterial enhancement is very, very useful along the margin of that lesion to look for recurrence. In December, we can see the 3 different parameters. You can look for arterial enhancement along the margin, restricted diffusion along the margin, and in this case, we also have increasing T2 signal. Any one of these should give you evidence that you have recurrence of the tumor after treatment.